Well, good afternoon, and thank you all for joining us. We've got about 1,000 folks now who are joining this conversation from Facebook or Zoom. You can also dial in. You can get the instructions to this town hall and all of our other town halls on our website, which is andrewromanoff.com. I'm told I'm going to cut out a lot during this conversation, which is really a dream come true for my staff. They'd like to mute me every day. So I'll just repeat the website. It's andrewromanoff.com. We're holding virtual town hall meetings every Friday at noon. We're also trying to arrange a conversation on Tuesday nights. We're all going to get through this crisis together, but we thought it would also be useful to provide some information and resources to try to address questions and concerns that folks are bringing. And I will tell you, just over the last few weeks, I've been amazed at the participation. We had about 1,500 people join this kind of conversation last week with a panel of infectious disease doctors, another 1,000 folks the week before with a group of mental health professionals. If you'd like to submit suggestions for future topics in these town halls, you can do that by emailing info@andrewromanoff.com. That's info@andrewromanoff.com. There's a game once where you're asked to identify 6 people you'd like to bring to a dinner party. So I'm going to introduce the 6 guests that we've chosen today. Deidre Johnson is the head of the Center for AfricanAmerican Health. John Harold is a farmer and a friend from Olathe, and encouraging you to enjoy delicious Olathe sweet corn. Julie Mordecai is a community activist, works among other organizations with Boys and Girls Club in Chaffee County, but lives in Alamosa. For the next 3 weeks, Jackie Whitsitt will be, did I get that right? 3 weeks, mayor of Basalt. Anna Stout is both a member of the Grand Junction City Council and the head of the Humane Society in that community. Joan Peck is a city council member from Longmont. So I'd like to thank all of you for joining us. And if you are viewing this conversation and would like to submit questions or suggestions or ideas, you can do that by tapping into the chat feature either on Facebook or Zoom. If you're listening into the conversation, unfortunately, you won't be able to submit questions, but we're going to try to post this video afterwards along with links to any of the resources that might come by. I'm told from one of our viewers that there isn't any sound. Can you all just give me a thumbs up if you can hear me on this panel? Other folks are saying they can hear the sound. So thanks. It's like our chat feature seems to be working because folks are chiming in saying they can hear us. So I'm going to start this conversation with Deidre Johnson at the Center for African American Health and ask you, in the midst of this pandemic, how the resources that you're providing are addressing the pandemic, what sorts of challenges the folks you serve are bringing, and what else we might be able to do. Deidre?
Thank you so much for inviting me today. So the Center for African American Health, we're one of the 30+ family resource centers around the state. Pre-pandemic, our focus is health education, health promotion, and navigating services. We have, for the past couple of weeks, stalled all in-person classes and really tried to focus on how can we get more resources to community. One of the #1 things we're hearing about is food insecurity. So trying to connect people with resources, whether it's with food banks or actual funds to buy food. Very concerned about our seniors, so we're checking in on them. And really doing a lot of listening. We also have a research panel, so we're about to do an online text survey just to really reach out to community and get more information about people's particular needs. But in talking to other nonprofits, everybody's stepping up, everybody's still doing their best to meet the needs. But you know, any insecurities folks had before, it's now on steroids, whether it's food insecurity, housing issues, you name it. So the real concern is taking it week by week, but trying to make sure we can do as much as we can for people.
Can I ask, Deidre, if you've heard from folks who feel they might need to see a doctor but are wary of going to a hospital, either because of concerns about health in the hospital facility or not wanting to clog a hospital that has COVID patients at the same time?
Not actually. We've done some peer recovery referrals with our partners over at MHCD. We've also
Mental Health Center of Denver?
Yeah. We've also helped folks when it comes to getting enrolled in insurance, but no specific, oh my goodness, I think I have this. It's more, I'm doing my best to keep my family safe, but we're running out of food. Or there is one partner we have where we do a parenting class. It's actually a shelter for women. And so we were able to provide them with some additional resources, which were strictly around food.
Great, I appreciate that. John Harold, at the other side of the state, you're in Olathe. You've been a farmer for a few years, at least as long as I've known you. Can you talk a little bit about the challenges that, what's that?
My hair was your color when I started.
I'm trying to catch up with you. So can you talk a little bit about the challenges that this pandemic poses for the agricultural community where you are in Olathe, or perhaps in other parts of the state too?
I think it's pretty common in the farming industry. I talked to David Petracco and Rob Sakata and so forth. We're all in the same boat because we use so much labor. We grow a lot of vegetables. And so I usually bring about 150 people under the H-2A program every year. And we brought the first group. They're going to be processed behind me in another 45 minutes. This morning, they finally got here from Monterey. But the concern is we are now just planting. Are we going to be able to have labor to harvest our crop come July? And that's the greatest concern we have now, is that we have to make decisions today that we're going to be really in July come to fruition. So the uncertainty in the agriculture industry, and as I talk to my farmer friends, we've had a meeting of the corn growers, and that was the greatest concern we had, is how do we plan and what happens if it doesn't work out? A lot of people think that because of the high unemployment rate, local labor will probably fill in. They don't understand that we usually start at 5:30 in the morning and finish at 3:30, 4 o'clock in the afternoon at 90 degrees during the daytime. And so I don't see much hope for the local labor. So the key is that the federal government continue to understand that labor is the backbone of the agriculture community now, and we don't have enough of it in our arena here in Western Colorado.
Is there any danger to either the safety or the quantity of the food supply, either now or if these projections hold, if we're stuck in the same boat over the next several months into the year?
I didn't understand the question.
I was just asking, I know we're trying to make sure that healthcare workers get protective equipment, but what's the situation for agricultural workers? And what impact is this pandemic having, do you suppose, over the next few months on our food supply?
Good question, because the 22 people that showed up at 8:30 this morning, every one of them had a little bottle of hand sanitizer in their pocket. Most of them were wearing masks. They are more concerned about it than I think our local community is. So they're very concerned about it coming out of Mexico. As far as the food supply, I think the agriculture community from both on the eastern side and the western side are going to go ahead and produce food. Whether or not we can harvest it and get it to market, that's a big concern. And so we're going to plant. We've made up our minds. As I said, we had a meeting with a bunch of growers the other day and said, the train's leaving, you want to go or you want to stay? And it was 100% said, we're going to move forward. So we're going to plant pretty much fence post to fence post and plan on harvesting the crops. So there should be a plentiful food supply.
Julie Mordecai, you live in the San Luis Valley, having similar conversations there with the agricultural community?
So as part of the Local Foods Coalition, I just left, retired from, but what came into fruition over the last 3 weeks is the food supply has been good at the grocery stores, but some things are missing. But people here suddenly realized we have a food coalition that aggregates food and then redistributes it. And so what we're finding is that all of a sudden people are interested in their local food systems. And the local food system really is all of Colorado. We include New Mexico, but the idea that, so, you know, that when things do get tough like this is a time to really think about local food systems. And so that's been a big push, both here in the Valley and in Chaffee County as well. We've started a group up there to start investing in farmers with low interest loans.
Any other creative solutions that you cross in the communities where you work, Julie?
Yeah, a couple things that back to Boys and Girls Clubs, anybody who's listening, many of us are doing online, many of the clubs across the state of Colorado. So if you live in a community that has a Boys and Girls Club, but even if you don't, you can go to their Facebook pages, and they're all providing resources for families to do fun activities and to continue education, so that's happening across all the Boys and Girls Clubs that I'm involved with. And then our
Thanks.
farm workers, can I say one other thing about farm workers and immigrants here? That's become a real issue, getting food to the immigrant community and the farm working community. They're afraid to utilize other sources right now. And so our Immigrant Resource Center is teamed up with our homeless shelter and food banks and providing a new food bank at our Immigrant Resource Center so that they don't have to go out in public to places they don't feel safe.
Don't feel safe for fear of federal authorities?
Yes.
For fear of?
Many things, but federal authorities.
Yeah, we're going to devote a town hall meeting to that conversation too. And I realize each of the topics that we're trying to address in short order today could be the fodder for an entire hour or more. So I'm going to ask a few questions of the other panelists and then try to do justice to the questions that are coming in online. Mayor Whitsitt, Madam Mayor, you are in Basalt. I know that we've heard a lot about the mountain communities being hotspots in this crisis. Has that been your experience in Basalt or in other parts of the mountains where you work? You're on mute.
Thanks, Andrew. I'm in Eagle and Pitkin County. Basalt is split in the middle. So Eagle County at this point in time has got much higher numbers than does the Aspen side. But I think it's going to get a lot worse before it gets better. I am friends with some folks in the medical community who say they get dozens and dozens of assumed virus, but we can't get the test, just like nobody can get the test, so we don't know for sure. But I tend to believe what the New York folks keep saying every day on the news, which is it doesn't look that bad out here in the rural areas, even in the resorts. But I think 3 weeks from today, I think it's going to be tremendously worse, and I think we're going to have to ramp up on the distancing and what we consider essential services, because at least if you go by the governor's essential services, we have got construction going on like everywhere. I don't know what the story is in Denver or other places, but so we've got, people riding 4 to a truck and out there working 18 inches apart on construction sites. So I see it ramping up a lot before we flatten that curve.
Are the folks who have come to Eagle or Pitkin counties for recreation, or the folks who are working there, maybe in seasonal jobs, staying? Are they going home? Are they stuck?
Well, Pitkin is pretty much uninvited everyone. And I'm not sure about Eagle because, it's on the other side, what exactly they've done. But Pitkin has ramped up higher than what the governor has, for sure. And is closing hotels and basically saying, please don't come here.
Yeah. Councilwoman Stout, you have 2 hats on, both as a city councilwoman, and I know you're not speaking on behalf of the entire city council, but also in your work at the Humane Society. So when it comes to serving Grand Junction in either of those capacities, is the pandemic playing out differently in Mesa County than it is in other parts of the state, to your knowledge?
Yeah, I think that that's sort of something that we're used to in Mesa County in general, is that things, you know, we're sort of contained here differently than the rest of the state. We're a couple weeks behind the rest of the state, frankly. We're not seeing rapid community spread yet, but we know it's coming. And so a lot of the orders that are coming down from the state obviously affect the entire state and have put us in stay-at-home orders sooner than we started seeing spread, which I think is going to be beneficial for us in the long run, but it's also harder for our residents to understand that what we're doing is actually because, you know, it's actually making a difference. You don't see the difference that you're making when the difference is no spread, right? So I think it's been a little more complicated over here to have people see their livelihoods interrupted so quickly without having seen the virus hit our community first, which again is a positive thing, but it sort of makes it harder for our residents to process that. And you know, we have a really strong nonprofit community over here, and the nonprofits have come together. We have a weekly phone call, and this is, you know, human services and other. And we come together once a week and we talk about what some, you know, how we can sort of cross over and serve each other's clients, how we can make sure that the resources available from each nonprofit are known to the other nonprofits so that we can accurately refer people to where those resources are. You know, just like what Deidre was saying, our biggest concern right now is food insecurity. As people are, you know, I think again, because the virus hasn't really reared its ugly head yet, people don't see the health crisis as impactful so far as the economic impacts have been. So we're really looking at ways that our city can support the nonprofit community, the ways that our nonprofits can support each other. And we're even starting to see some really interesting public-private partnerships happening sort of spontaneously and informally, such as businesses who are still employing their employees, but don't have work for them to do. They're deploying them to help volunteer at some of these nonprofits that, like an example would be Meals on Wheels. They serve 500 seniors meals per day, but the majority of their volunteers are seniors themselves who now can't go out because of this. So we've seen a lot of that happen very creatively. And I think, you know, Mesa County always feels like it's a little bit different from the rest of the state. It's the Wild West out here. And I think John probably has a similar feeling over in the Olathe area. But there is a sense of, you know, coming together, and we've got to come together to do this on our own because we do experience things very differently than the Front Range does.
Just to sneak in one quick question before I turn to Councilwoman Peck too. I know, Anna, you run the Humane Society, and the virtual town hall we had last week, a couple folks asked about any evidence that dogs or cats or other pets can communicate the virus, and we were told, at least by the infectious disease docs who joined us then, the answer is no. But I wonder if you've seen a decline in adoptions at your Humane Society, or for that matter, an increase in people dropping off pets because of that fear.
Yeah, actually, on the contrary, what we did is we mobilized. We saw this coming. You know, we were watching what was happening around the world, and as it was sort of enclosing in around us here in the U.S., and we mobilized very quickly and got almost all of our animals into foster care. And what we've seen is a lot of people are still interested in adopting and willing to adopt because, you know, when you're at home, it's a great time to have the companionship of an animal or to lend a hand and foster an animal. We have not yet seen animal surrenders increase because of the fear of the virus, in part because, like I said, the virus isn't really here yet. But what we anticipate is more surrenders due to the economic impacts, people not being able to pay for veterinary care or food. And so that's one of the reasons that we emptied the shelter and got all of our animals into foster care so that we can step in those emergency situations and either try to provide resources. We have a pet food bank, and we work with organizations like Catholic Outreach and Meals on Wheels and Greg Gourmet to try to deliver pet food, and we have staff members who are delivering pet food and supplies right now as well. We hope, though, that we're going to be able to counsel people if there is fear around, you know, animal to human transmission. It's simply the evidence does not show that that's something that people need to be worried about.
Right. Thank you. Councilwoman Peck, just moving back to the Front Range here for a second. What the conversations that you all are having on city council or with state government, how is Longmont handling this challenge?
Oh, thank you. And I also want to have the caveat that I am not speaking for council. I am speaking actually for myself on council. So how are we handling it? I think Longmont's doing very well. We've got an incredible staff and we have not seen a huge surge as of yet. We're working with the Boulder County Health Department, and as of today, with as far as the testing goes, we've had 132 positive tests. 47 of those were hospitalized and 68 of them recovered. So having said that, we don't know how many people were actually tested, and Longmont itself doesn't have any kind of statistics as to how many of those people were from Longmont. We're working on that. We're also, what council is doing is actually working with staff to be their voice for the public. We're going to be doing, and some council people have already done videos through our Longmont public media to let the public know what's going on, since we don't have any meetings in the normal. Now we're all going WebEx with public invited to be heard through email or text or whatever. We do have the same issues that I've heard from other people on this panel, which is about volunteers, because everybody is doing this stay-at-home request or mandate. That includes our volunteers. So volunteers for Meals on Wheels, again, volunteers for the homeless to be able to drive them to the Boulder shelter or to the Boulder Rec Center, which we're using as, I'm going to call it triage. Anybody who shows symptoms but haven't really been tested are being taken to the Boulder County Rec Center. I'm sorry, not Boulder County, City of Boulder Rec Center, where they will be housed until they're either tested or their symptoms, if they have a fever or whatever, goes away, so that they're not out in the general public. The staff is having weekly and sometimes daily meetings as this whole environment changes, to keep up to date with what's going on. We're working with we're very concerned about our small business and the loss of revenue. So we have a whole team that has been working on the CARES Act, fielding calls, giving them information, where to go. And just as of yesterday, we have an incredible law firm that is willing to do Zoom meetings with people who want one-on-one contact with an attorney to help them walk through this process. And also perhaps some videos to put on our Longmont public media as to where to get the applications, how to work through it, what banks are giving SBA loans, etc. Yes.
Let me ask just along these lines. We're getting flooded with questions, which means that you all must be too. Is there a one-stop shop? If you're living in Longmont, or for that matter in Grand Junction or Basalt or Alamosa or Olathe or Denver, I mean, is there one place that people can turn for all of their questions? Do you send folks for most of these to the State Health Department?
Sure, I'm glad you asked about that. It is going to be the Longmont Economic Development Partnership, and the subcommittee of Longmont, of the LEDP, is Advanced Longmont 2.0. They have a staff there working probably at this point 24/7, fielding calls, making people, just fielding calls, giving them information, telling them where to go, what the deadlines are, the different pots of money that CARES Act has been dropped into, and where they can, which pot they should go to try to get the reimbursement that they need. They can also go to our website, the Longmont City website, and search on the CARES Act, and they will be able to get information there as well. Our Longmont Public Media, the Observer Online, also has a lot of contacts.
So for folks who don't live in Longmont, and I don't know, we don't need to list all these answers here. We can put some resources in the chat feature, and I'll ask Seth to do that if we can get some other thoughts. I know we've been steering folks to help coloradonow.org when they want to volunteer their time or donate resources. Deidre, if folks wanted to make a difference in the Center for African American Health, how do they do that? Do they just go to your website? Are there opportunities to get involved, at least virtually, there? And you're on mute. You have to unmute yourself there.
Sorry about that. You know, right now, there definitely are opportunities, especially with multiple family resource centers. So I would encourage folks to reach out locally, since we are talking about the state, to your family resource center. And for us, we're also working closely with our family resource center partners. So, you know, an email, if you're interested. We're kind of doing things in waves. So I've got my staff working remotely from home, but on call as different projects and things come up to help community.
One of the questions that's coming in online, and I'll direct this to Dee or anybody else who might want to answer, is to give thoughts about donating blood. I know we've heard that request. Is that something folks are doing in your communities or should be doing more of?
You know, I think there definitely should be doing more of it. I received an email today, and this is actually from my college network, where someone was looking not only for blood donation, but for their family, they needed a blood donation from someone who but had recovered for at least 14 days. So I think there's supposed to be
I'll just hang. Got it. Go ahead. Sorry,
Okay.
Deidre, go ahead.
Oh, it was an email I received from my local college group. Not only a call for more blood donations, but they were actually looking for some specific donors who have recovered from COVID, with the understanding that I guess as long as they're recovered and symptom-free for 7 days, their blood donation might be helpful for this person who's in dire straits. So I need to look more into that, but I thought that was interesting. Not just regular donors are needed, but also donors who may have recovered is another way to help.
We're going to bring some other health professionals onto next week's panel to make sure that that information is available.
Andrew?
A question coming in that we've gotten a lot in the last few town hall meetings is about domestic violence. And just to anyone who might be comfortable answering this question, what extra help is being provided to domestic violence victims and their children who are sheltering at home with their abusers? Are they being given an anonymous number to use? Are special sheltering opportunities being pursued for them with input and guidance from organizations that provide these services during ordinary circumstances? Anybody in our panel have experience in your community around domestic violence organizations? And if not, we can also make this the focus of, yeah, go ahead, Julie, feel free to just chime in, and you should unmute yourself if you want to speak.
You know, I helped with the building of our local program, but I don't have the answer to that. So I don't know why I'm raising my hand. I just know that they're literally closed. And so, and our shelter is also closed to people except the people that were already in. And so I was very interested by the Longmont situation where they're turning the rec center into a homeless shelter. I mean, that's huge. I've just shared that information with our city.
Joe, do you want to weigh in?
I do, thank you. Yes, we're working with the Boulder County Health Department. I just saw a question come in from a woman who lives in Longmont that wants to know, what do they do if their employer is not complying with the health and mandates down from the governor? And all of those questions need to go to the Boulder County Health Department. And I'm very pleased with Boulder County in that how we've all come together and worked out a system that works for us, as far as we have overnight emergency sheltering for our residents, a homeless population in 2 churches. And as they come into those shelters, we are doing very basic physical, I guess it would be triage. We're taking temperatures, we are asking them about colds, coughing, etc. That is what the rec center in Boulder is set up for. If they show any signs of having any kind of physical problem without being tested, that's when we take them to the rec center in Boulder, so that if they are infected, we are not spreading that. So far,
the same question then.
yes.
Sorry. I'll put the same question then to Anna and to Jackie with respect to Mesa and Eagle or Pitkin counties. When it comes to DV services, or to the point that Joan's raising, if your employer is not complying, how do you handle that? Do you go to the county health department in your communities?
Yeah, here in Grand Junction, in Mesa County in general, the health department really is the head of our incident command for all of this. So that would be the starting point. So for anyone that is, whether it's obviously a domestic violence situation, if a person's in a situation and feels comfortable or can get away long enough to reach out to law enforcement would be the one to contact for any kind of DV. I know that our shelter here, Latimer House, is often at capacity, but I think that this is the kind of problem that we have to solve as a community sort of spontaneously. It's a higher demand at this point for services in general. So if this means that we as a city come together, we as a community come together, nonprofits, to find ways to get people in hotels or to get people into other safe places, I think that would be a need that would be addressed as we start to, lift the skirt up a little bit on it and see what's happening underneath when we're getting these calls. So there's that, and any non-compliance with health or the governor's restrictions or any other orders that are coming down to keep people safe from the virus would need to be directed to the health department first and foremost.
To the county or the state?
The county health department. And I have to say, one bright spot in this whole situation here is just watching the way that our health department has handled this. They have been on top of things. They've been communicating. We really are fortunate to have an excellent health department here in Mesa County.
So Andrew, over here in the resorts, we just this week had the police and sheriff all sign off on a letter that they're going to be enforcing, because I think the problem is with employers, or mostly employers, who are not causing compliance to happen. I think it's really difficult when employers aren't there. I'm thinking again of construction sites. So our police and sheriffs are going to be out there keeping an eye on this, because there's just no way, it's too far flung for us to try to keep tabs on each other. I agree that the health department is where it ends up, but the health department is not an enforcement agency and they're not out in the field. So it's great that people are really stepping up. They're taking this very seriously.
Let me ask I appreciate that. Let me ask to Julie in the Valley and to John in Olathe. A lot of the services that we're directing folks to rely on the internet. Not everybody, even during ordinary times, has access to high-speed service. And I know this is true in other parts of the state as well, but has that problem been exacerbated during the pandemic? Are people able to go online now in your communities?
I'll start with
Julie,
this one. And actually, so this was something that has absolutely come up, especially with people who are working in our low-income populations. One thing that we saw happen was the library has been the point that a lot of people who don't have, not only do not have access to the internet, but they also don't have devices. So even if they were given, free access to the internet, if you don't have a device to connect with, that's meaningless. So our library used to be that point that people could go and, use a device that connects. They are making their Wi-Fi available all the way out into the parking lots all day until 10 p.m., which is something that has been very helpful for folks to be able to go, and especially people who are looking to file unemployment claims or anything else online. The biggest issue we're still experiencing is how do we help people who don't have devices access not just, not just things like unemployment claim forms, but also information, just the communiques that we're sending out as a community through the health department, through the city, and through different organizations. So that's a challenge that I think is still working to be met, but the library making that Wi-Fi available has been very helpful for the people who have devices.
And Andrew, I would say that challenge defies geography.
Yeah.
The same as the case in urban communities, because it's really an income question.
But in rural areas, we don't have we don't have high levels of internet, period, even in community spaces in some of the smaller towns. So that's probably the little bit of difference. Buena Vista School District sent home tablets with all their kids. And I don't know how they're getting hooked up to the internet. Maybe they're going through data or whatever, because they had to continue learning, and they wanted that they had money to be able to do something like that. But as far as the San Luis Valley goes, we know that the Boys and Girls Clubs in Alamosa are sending home weekly packets for kids to do stuff, and they're providing food both the clubs throughout this region, providing lunch every day, because sometimes school is the only place to get lunch. So a lot of our kids are accessing activities and lunch through the clubs and partnership with the schools.
Mesa County did the
question
same thing. The school district has sent out Chromebooks to students and is continuing to provide lunches to all students every day. They can come do essentially a drive-through through the schools. I think that that's, again, one of the things that's been amazing about this entire crisis is to watch how each entity, each institution, each organization has found a way to provide some kind of solutions to the issues that are facing people, even though there are still many that need to be solved. There has been no lack of creativity and stepping up to meet those needs.
I want to come back to the point that Deidre's making too, because clearly, while this coronavirus presents a risk to all of us, the income disparities make access to services harder to come by among some communities. And there's a couple questions coming in around homelessness and the impact that this crisis presents for folks who are homeless, generally for homeless veterans, particularly. Do any of you have some experience in addressing the needs of the homeless community?
Andrew, John Harold, I'm on the board of Lighthouse, which provides, we call it emergency shelter rather than homeless shelter, because I think it's more accepted in the community. And so we have quarantined our shelter for now 16 days. And we belong to a program called Wages, which is also services homeless veterans. The problem is that it's really not a stable population. And so those that were there at the start of the pandemic are the only ones allowed to stay. And if they decided they're going to leave, they could leave, but we're not doing any new intake because of the concerns of spreading it. I think there's now 18 residents. But the other thing we're doing is we're trying to we usually use it for 6 months at the end of April, 1st of May, then it converts to a migrant housing. But we're thinking very seriously that we might try to run that thing all summer, a lot depending on how this pandemic plays out. But that's our solution to it. The shelter that I volunteer for in Delta, it closed its doors about 30 days ago. And now ironically, just before you called, I got a phone call from the health department in Montrose County wanting to know if there would be a possibility to maybe use the shelter, emergency shelter, for a rehabilitation center for people that are recovering from the virus. So there's a lot of concern about space to do a variety of things. But the homeless so far in Montrose County, I think, have been taken care of well. Delta County, it's really just closed and they're left on their own.
Mesa County is also really falling short in this area. We don't have, currently, we don't have a place where somebody who's experiencing homelessness can self-isolate properly. We don't have a quarantine or isolation space as part of our shelter, and everybody who is in the shelter is, right on top of each other. And this is something that the homeless shelter is working on individually, but as a community, we have really, really fallen short on coming together and finding solutions for people experiencing homelessness. And frankly, I think we're forgetting that is going to be a massive source of our vector transmission if we don't take care of them.
Andrew, this is
Yep.
Joan. Actually, this is a discussion I had this morning with our city manager, and that it isn't a huge problem at this point, but we do need to have some kind of a plan in place. It was mentioned in some of the talking points that I received that we were having an issue with our homeless riding our free local bus during the day because they have no place to go. Our library shut down, the YMCA shut down, a couple of fitness places that allow them to come in. There's no place for them to wash their hands. There's no place for them to isolate in place. I think down the road, we need to start thinking about this now instead of waiting until it becomes a crisis. So that is a conversation that I am going to bring up with council so that we can head it off and not be overwhelmed with this issue. RTD has actually not been an advocate for homeless riding our buses. And for obvious reasons, this is not a bash against RTD. It is just an issue that has come up because of the virus. And so now we have to look at it. If anybody has any solutions out there, I would love to hear what you're thinking about and how you want to address this. Thank you.
Let me just jump in to say, if folks want to share some solutions, you should feel free to post ideas and questions in the chat room. Deidre, I know you're going to jump in here too, please.
Yeah, and it's not, I don't have a solution, but I do have a group I don't want us to forget about. And those are the folks who, at least along the Front Range, live in hotels. So
Yes.
those kind of, and the motels. So they're still housing insecure, even though they have a home of sorts. But the way that jobs are being shed, there's just going to be a wave of this happening. And so, as you said, it's better for us to plan what we can do now, because we have more than just the typical pressures that we already had trouble dealing with about to hit.
And I hope that this becomes not just looking at this problem specifically, but all of the issues that we're being faced with as communities, we're having to jump in and find solutions. And I hope that we view this as an opportunity to turn many of these into long-term solutions. As we're looking at how to provide homes for somebody who's under a stay-at-home order and does not have a home to stay in, I think that that's now shedding a light on those individuals. And I hope that we as communities come together and figure out ways to address this need now during this crisis in a way that becomes more permanent, and in a way that they're, you know, at the top of mind in all situations, not just when we're facing a crisis. I hope that by creating spaces for people to self-isolate, those spaces can become more permanent housing, you know, as a general standing structure for folks long after this crisis. And I hope that as municipalities and as counties and as a state, we take all of the insecurities that we're finding in our social systems and we strengthen them as part of this crisis and emerging from the crisis.
Bravo, Anna.
As a point, go ahead. You're agreeing? It's a point well taken, and I should just say, by way of previewing a future town hall, we're using this conversation and the next several to talk about how we literally survive during this crisis and mitigate the damage and stop the spread. But we do want to devote some future conversations to what policy implications this pandemic may have for us going forward. What does it say about America's healthcare system, for example, already in crisis when you think about the fact that some 72 million Americans are uninsured or underinsured, 500,000 families are going bankrupt, and 35,000 folks die each year because they can't afford medical care. So I don't want to lose sight of the longer term conversation, even if we have to punt it to another Friday at noon. If I can just tease out a couple of the questions that came up. When it comes to finding space for folks without homes, I know other communities are making use of hotels, in some cases even turning them into makeshift hospitals. Is that a source of housing for folks? I'm thinking of places where there's an ample hotel space. I don't know if there's staff or if the hotels themselves are prepared to handle people who need homes but can't pay for them.
Here, actually, that is one of the solutions that our homeless shelter is exploring. And they've actually spoken to two different, I think motels actually, about their willingness. And it sounds like they have two that are both willing to do this at a very reasonable rate. The issue that I see here is that it is a very temporary solution. we can put people in there for quarantine, we can keep them in there and keep them segregated from, you know, let's call it healthy society, until we can get them better and provide them that shelter. The problem is that once we emerge from this crisis, those motels turn back into a crucial part of our tourism industry, which on the Western Slope is a massive part of our economic stability. So I think that it is currently a really great short-term solution, but I think that we have to be careful not to look at that as the way that we solved our problem now, and then let the problem continue to be unresolved in the long term.
I take your point, and I'm not suggesting this is a permanent solution, but are there other communities that are making use of hotels or motels or other buildings that are going less than fully occupied to solve some of these problems? And I also want to ask, while you're thinking about that, a related question, which is not to increase the homeless population. And there's a lot of questions that are coming in both today and in past town halls about a need not to evict people or foreclose on them, kick them out of their homes simply because they can't pay the bills. If you don't have an income coming in, 10 million Americans have already filed unemployment claims. It doesn't seem fair, and it shouldn't be legal, in my view at least, to evict someone from their home now. Has that problem come up in your conversations with tenants or landlords or homeowners, for that matter, facing mortgage payments in any of the communities where you all work?
Well,
Go ahead.
in here, who did I interrupt? Because if you haven't had a chance to speak, I'd love for you to speak.
Go ahead.
Go ahead,
Okay.
Julie.
All right. So here, I'm involved with some small businesses, and I think what most people are trying to do is talk to their landlords and have discussion versus like, okay, I'm not going to pay rent, and many of the people that I know here, because we're really a pretty tight knit community, you can call and say, hey, listen, this is what's going on. And then you try to figure out how to work things out. And I really wish we would promote that. I'm seeing a lot of stuff around all over about people not paying their rents or whatever. I think having conversations with landlords, many of them don't want to lose their tenants, especially in the small business arena, and negotiating a less expensive rent or some time not to pay rent or putting rent off for a little bit. Or being forgiven for a month or two, because having to re-recruit somebody to be in your spaces as a landlord, especially in the business sector, is not fun. And especially if you've had somebody in there for years, So I think people just need to go into partnership with their landlords and talk to them. And then if that doesn't work, then there's the other solutions. But I think this is the way that we should treat each other.
I haven't been directly involved, but I've heard about a few communities working on kind of eviction moratoriums. When those first came about, it was a couple of weeks ago, and they were short term. One of my real concerns is I know a lot of people that have lost, like I'm in the nonprofit sector. I have so many corporate folks I know that have just lost jobs, whether it's a national group or local businesses. And so even if you do have those couple of months, we still got to get folks working again.
So Andrew, in Longmont, we have a landlord-tenant alliance where we have facilitators and mediators working with landlords and tenants, both small business and residential, to help work through these issues so that we do not get people displaced from their homes. So far, it's been working pretty well.
One of the questions in the very few minutes we have left is if anyone can speak to essential versus non-essential workers other than medical. How are staff members staying safe? What are the responsibilities of their employers?
So I can speak to this just because from the animal shelter perspective, animal shelters were included in the governor's order as the critical businesses. And we're very concerned about our staff's health, but also understand that we're keeping animals alive. So what we've done and what we're encouraging our community to do for any of our essential businesses or critical businesses is to find a way to divide your staff into teams so that as the virus hits and, the likely exposure of, 40 to 80% of our community, we want to make sure that not everybody gets sick at once. So we have people very sort of segregated in their teams so that they're only exposed to each other when they come in, and we're making sure that that the organization is creating ways that people can be this, the proper 6-foot social distance from each other whenever possible. We have, we've been really hammering the sanitizing doorknobs and frequently used items. So I think that it's just really important to understand the epidemiology of this virus and the transmission and everything else, and how this virus takes, makes its way through, and that we're protecting those workers while they're there, and also being very careful to, protect the people behind those workers, whether they have family members at home or if they have obligations to take care of, a neighbor or an elderly person. We're just trying to be very, very careful that we're containing as much as we can while still carrying out the essential functions of the animal shelter.
I appreciate that. And we're getting a number of questions better aimed perhaps at an epidemiologist, so I'll save those for a future panel. There's a question here about small businesses that are struggling to navigate the application process for Small Business Administration loans. One person asked, we need to act quickly here in rural Colorado if we want to save these small businesses and their employees. Is that a conversation that
we're having it? And the governor's put together a task force, and Rennie Fagan is on it, and he's reached out to us. And what I think that's what, having counselors, bankers, ex-bankers working with people, but they need to get signed up by tomorrow. And today are the days that it's open. So people have to get in communication with their banks as of today to start the process. So if you're a listener and you have a small business, the SBA loans to protect different pieces of your business are now happening.
Although not all banks are moving quickly.
And they're moving quickly.
Not all of them.
Oh, not all.
Andrew, the
John, go ahead.
problem with the SBA program is the banks are in the dark about it. I talked to 2 different bankers today, and they won't give you any answers because they're looking at their computer screens as you're talking to them and say it's changing by the hour, by the minute. And so that program, I've been reading about it, but it's being rolled out without any forethought and without any support for the bankers. And so that's the biggest problem that I see with it. It's more a publicity stunt by the administration without any real forethought, and the bankers just can't. They're overwhelmed with it because they don't have good guidelines.
And I do want to say once again that if your bank is not a bank that does SBA loans, it won't help you. Not all banks work with SBA.
It sounds like a good topic for a town hall as well, to bring on some folks from the SBA, from bankers, economic development officials. The projections I've seen suggest that something like 1/3 of the American population may be facing unemployment. So to me, at least, this is a New Deal moment for America, and I don't believe history will reward our timidity as we try to recover, not just from the pandemic, but from the economic catastrophe that it's causing. One last quick question I'll try to sneak in here that tethers a couple of the points you all have been making. Someone is a small business owner and facing eviction themselves. This person happens to be living in Englewood, but they want to know, who do they contact as a small business owner facing eviction? Or who would they contact, I suppose, if they lived in your community?
That's a really difficult question. It's a difficult situation. I think that, there are a number of layers there. And as Julie was saying, start with working with the landlord, seeing if there's any help there. I would suggest talking to the Chamber of Commerce, if there's a business incubator, any of those sort of economic development partners in a community would be, that starting place. I think that the hardest thing right now is that what we're seeing come through in these relief packages is still being defined. It's, as it's filtering down to states from the feds, states are then having to put shape and define the way those things are going to be distributed and what the priorities in each state are going to be. And it's still such a gray area for everyone that it's hard to tell people just to wait until we have more clarity on that. But until we have clarity, it's just, I understand that difficulty right now of being in a situation where you have to leave and thinking there may be some relief coming, and hoping that relief can be clarified and reach you before you're evicted from your place.
There's 60 seconds now. Somebody's asking about the elections that are coming up in June. What actions should or our county's taking to ensure voter safety, especially for in-person voters and those who have increased risk? And the election, I imagine that this person's talking about are the primaries on June 30th, which in which all Coloradans will get a ballot in the mail. And I don't know if your communities are talking yet, a little less than 3 months out, about polling places that will remain open in person, because all of us, at least those of us who believe in democracy, share an interest in maximizing voter participation. Does that question come up in any of your communities? Too soon to be talking about the June election?
Yeah, not to my knowledge, but it seems like a great town hall conversation as well.
I'll tell you, just speaking from the experience as a candidate, I think politicians find ourselves at the bottom of the list of essential workers right now. At least that's the reaction that we're getting when we're talking to voters, and for understandable reasons. So a campaign may not be essential, but I'd say democracy is. And I want to make sure we keep our democracy going, even if at the moment we're forced to conduct it by these virtual means. So I want to thank each of you for sharing time out of your days in what I know is an extraordinarily difficult time for all of us. I remain convinced that we will get through this crisis best by coming together, even as we are forced to stay apart. It's one of the paradoxes of this pandemic. At the moment where we're taught to engage in what is misnamed social distancing, we really need to be standing as one. And I appreciate your willingness to share some thoughts and ideas. We'll continue these conversations every Friday at noon. Stay tuned as well for Tuesday night virtual town halls that we're trying to organize. You can find all the details on my website, which is andrewromanoff.com. You can also find us on Instagram and Twitter and Facebook at Romanoff 2020. I'm not ready for my close-up here, so you'll have to wait until we add a TikTok feature to our virtual campaign. But I really appreciate your generosity as panelists and the participation of the more than 1,000 folks who joined us for today's virtual town hall. Stay well.
Thank you, Andrew.
Thank you.
This was
Thank you.
Students.
Thank you, Andrew.
Thank you all.
good luck out there.
Yes, vote for Andrew.
You too.
Vote for Andrew.
Thanks.